When a patient develops platinum-resistant ovarian cancer, or they're at the point where they're drug resistance, I like to focus on appropriate understanding of what's going on, and I never want to give up hope.
So this phase of the patient's treatment journey, this platinum-resistant ovarian cancer phase, can be a difficult one for patients. They kind of understand that they only recently finished chemotherapy. So I try to be very honest with the patient about the situation. I try to tell them why it's challenging, tell them what they might experience, but then also give them hope that there's support there for them.
It's important to remember the human connection, and so I think you can do it as simply as acknowledging that in the midst of your visit. I think social media has pluses and minuses, but there is a network of survivors. There's a network of patients with platinum-resistant ovarian cancer. There's always a group that I think can lend support, and that is one of the pluses of our technology and social media.
There's many different websites out there that the patient can access. One website that is reliable and has important information on it is cancer.org. Another one is cancer.gov. Another organization is the Society of Gynecologic Oncology, or SGO. There's information on that website. I encourage a patient to reach out to local organizations that are specific to ovarian cancer or gynecologic cancers. I also encourage the patient to reach out to my staff or to me if there's questions. Frequently what I realize is when I'm talking to a patient in the office, a lot of what I say does not sink in. The patient does not remember what we talked about. So I encourage the patient to reach out to me again if things weren't clear, if something was confusing. And then I think it's really important that the patient either brings a family member or a friend or a peer to them at the visit, or have that person on the phone. The person on the phone can actually, or that's in the room with the patient, can actually absorb more information than the patient themselves.
I think that one way that we can try to help our patients to maintain hope in the platinum-resistant ovarian cancer setting is by offering realistic expectations. And so part of that is going to be to lay out the road forward and to recognize that we are going to offer the options that will have a chance of giving them quality of life. But I think there's some hope to be offered in autonomy, and so to remind the patient that at the end of the day, it's their life, and it's their body, and it's their decision. And so we have to empower them to decide when they want to continue the next treatment, if they want to continue the next treatment. And I think that hope needs to be a matter of making the most of every day.